Hello, I'm Adam Scott, and this is the Roland-Morris Low Back Pain and Disability Questionnaire assessment of the Roland-Morris Low Back Pain Disability Questionnaire. What this presentation is, I am going to be telling you about the Roland-Morris Low Back Pain Disability Questionnaire, and I am going to be telling you how it is administered. What are some of the question types that are going to be prevalent in this exam, and I'm going to be telling you my opinions on this exam. So let's get started. So first of all, what is this exam? It is a patient self-report assessment in which the document asks the patient several questions regarding the details of their low back pain. This questionnaire is specifically designed for people with low back pain. This assessment is a subjective exam in which the exam tells different scenarios to the patient, and the patient checks which scenarios apply to him or her. And in the next slide, there is a picture of this questionnaire, and you'll be able to clearly see what I'm talking about when I say that the patient checks specific scenarios. The clinician can then give the questionnaire to athletes after the patient has undergone some time with treatment and rehab to assess if they have any changes in the ability of him or her to perform daily activities that are asked by the questionnaire. So as you can see here, this is the Roland-Morris Low Back Pain and Disability Questionnaire. As you can see at the top, it asks for the patient's name and then the date and then the file number, which clinicians will use to file this questionnaire with the specific person that is that's taking this assessment. As you can see in the middle, there are different scenarios that are caused by low back pain. So, for example, at the top, the statement is, "I stay at home most of the time because of my back," meaning that the patient can't go anywhere because his or her pain is too intense that the person can't even get out of their own house. And if this were to apply to a patient, then that patient would simply put a check marks or an X right beside the box that is directly adjacent to the statement. So that's how the patient fills out this this questionnaire, and I'll get more in depth in what the clinician can use the results from this questionnaire for. Some of the types of questions, as I stated before, these types of questions are scenarios that people experience with having low back pain. As stated in the title, this questionnaire is for people who have low back pain. The questions deal with situations that people do on a regular basis, only this time the questionnaire is asking if the patient can't do the activities or if they have pain while performing the activities. The specific scoring structure of this exam is not like some other questionnaires. This exam doesn't have a scoring range, meaning that there is no scale to indicate the severity of the patient's condition. What this means is that you can't tell whether or not a person is in extreme pain or the severity of the low back pain. You can't tell how bad it is based on this questionnaire. We just get whether or not the patient can perform certain daily activities of living. And the way that we evaluate the patient from this questionnaire is by giving the patient the questionnaire before the treatment and rehab sessions, and after the patient has undergone some treatment and rehab sessions. So it's a before and after questionnaire. We then take the scores from the 2 times that the questionnaire was given, and then we compare the 2 results of the documents to see if the patient is either improving or getting worse. We can then calculate the percent of improvement by dividing the number of boxes that were not checked compared to the number of boxes that were checked at the beginning of the treatment sessions by the number of checked boxes at the beginning of the treatment. That number is then multiplied by 10 to get your percent of improvement from the beginning of treatment sessions until now. I know that really sounds confusing, and I'm going to go back to this questionnaire. Down at the bottom, you can see here an example. So if, for example, at the beginning of treatment, a patient score was 12, meaning that there were 12 boxes that were checked. And then at the conclusion of the rehab session or the treatment session, their score came down to a 2. Then that would be a 10% improvement. So you subtract 12, which is the beginning score. The beginning score of the questionnaire when it was first administered, and then you subtract that by 10, which is you subtract it by 2, which was the results, or how many boxes were checked after the patient was done with the treatment sessions or rehab. So then, as you can see here, that would be a difference of 10. So that means there would be a 10-point improvement. And then we would divide that 10 from the original score that we got at the very beginning of the exam. And then from that, you can multiply that by 100 to get 83%. So there will be an 83% improvement of the low back pain. The instructions, I believe, are very clear and easy for the patient to follow. All the patient has to do is, if a situation stated in a questionnaire applies to him or her, then they just simply check the box next to that situation. I do like this questionnaire because it can show if the treatment sessions or rehab sessions are helping the individual with some of their daily activities, because that's the main thing that we are trying to focus on when we're trying to treat low back pain, is if the patient if we can subside the pain enough so that the patient can do their activities of daily living, then we know that the treatment and her rehab sessions are helping. The one thing I don't like about this questionnaire is that it doesn't have a grading and or scoring system that says the severity of the condition. What I would like to see, if they do a revision of this questionnaire, is to maybe put a point system beside each condition, and the higher the number of points, the more severe the low back pain would be. Something along those lines, and then we can take that result and then see what steps we could do in order to come up with a better treatment plan for this person. For example, if the pain was severe enough, we should start with some modalities, whether that be traction, whether that be electrical stim, to treat the pain. And then once the pain isn't that bad, once the pain has subsided some, then we can start on some strengthening exercises to help the patient with this low back pain. To wrap things up, This questionnaire can definitely be used for sports medicine practices because low back pain is very common among athletes and just people in general. People who do a lot of activity, whether that be a professional football player or a construction worker. We can use this questionnaire to see if our treatments and rehab sessions are actually helping the patient. Um, so that's basically all that I have as far as this presentation, and I hope you have enjoyed it. Thanks.